Extraction. It is probably the scariest word patients hear before starting braces. Some people are told they must remove teeth. Others are told extraction will ruin their face. So, do you really need tooth extraction for braces? Let's find out. This is one of the most common questions my patients ask. Doctor, do I really need to remove teeth? The answer is not yes or no. It depends completely on your specific case. So, let's break it down simply. Extraction sounds scary because we think removing teeth means damage. But in orthodontics, extraction is not about damage. It's about space. Teeth need space to move safely inside the bone. If there is no space, teeth cannot align properly. So, sometimes creating space is exactly what makes treatment safer and more stable. So, when is extraction actually necessary? Let me show you the most common situations. First, severe crowding. If the teeth overlap heavily, there may simply not be enough room in the jaw. Trying to align them without space can push teeth outside the bone and harm the gums. In these cases, extraction creates the space needed to move teeth safely. Second, protruding teeth. When front teeth stick too far forward, they can affect the lips and the facial profile. By removing specific teeth, we can move everything backward and improve facial balance. Sometimes extraction actually improves the face, not harms it. Third, bite correction. When the upper and lower jaws do not fit together properly, extraction can help us balance the bites and create a more stable result. So, in these situations, extraction is not a shortcut. It's a planned and smart decision. But here is something very important. Not every patient needs extraction. In fact, many cases can be treated without removing any teeth at all. Today, we have several alternatives. We can expand the arches, we can use IPR to create tiny spaces between teeth, or we can use different mechanics to gain space naturally. So, extraction is only one option, not the only option. Now, let's talk about the biggest myth. Extraction ruins your face. This is simply not true. When done correctly, extraction does not collapse your face or make you look older. For many patients, it actually improves the profile and makes the smile more balanced. The problem is not extraction. The problem is poor diagnosis or poor planning. Of course, extraction can be wrong in some situations. If there is not recrowding, if space is not truly needed, or if the treatment plan is rushed. Removing teeth without a clear reason is a mistake. That's why proper records, X-rays, photos, and careful analysis are essential. Extraction should never be automatic. It should always be individualized. Orthodontists decide based on careful diagnosis. Every case is different. Every treatment plan is customized. So, here is a simple rule to remember. Extraction is not good, extraction is not bad. It's simply a tool. The right decision depends on you and your specific case. Orthodontics is always case by case. If this video helped you understand tooth extraction better, make sure to subscribe for more honest orthodontic tips and real cases. And check out my previous video about how braces can change your facial profile. Thanks for watching, and I'll see you in the next one.